Hi, everyone. Welcome to Embracing Sensitivity, Enhancing Impact, developing a co-production model of public engagement for administrative data research. My name is Elizabeth Nelson. I'm the Public Engagement, Communications and Impact Manager for the Administrative Data Research Centre Northern Ireland. ADRC is a partnership between Ulster University and Queen's University Belfast in Northern Ireland. And alongside our colleagues in the Northern Ireland Statistics and Research Agency, we work to facilitate access to administrative data for research and for public benefit. My co-authors on this presentation today are Dr. Aideen Maguire from the Centre for Public Health at Queen's University Belfast and ADRC, and Dr. Frances Burns, also from the Centre for Public Health at Queen's University Belfast and ADRC. So just to give you a quick overview of the Northern Ireland context for anybody who's not familiar, we are constitutionally part of the United Kingdom. We have our own devolved government assembly at Stormont, population of about 1.9 million, a nationalised health service, which is part of the UK. Our currency is the Great British Pound Sterling, and we border and share an island with the Republic of Ireland. Our devolved government collapsed in January 2017 and remained collapsed until January 2020. So within our space where policy impact for our research is very important, this made it very difficult to achieve policy impact. This was because the data custodians, which were within the health service and civil service, while they maintained responsibility for access to sensitive data sets, there was no political drive or push to improve data access. And oftentimes the civil servants weren't empowered to make the kinds of decisions that were required to open up data access. This meant that public engagement became even more vital in terms of impact and data access. So because of the uncertainty of the devolved government, we focused on interacting with the public sector, so civil servants and policymaking roles and data custodians, which helped to shape the research by making it policy relevant, which enhanced their ability to produce evidence-based policy and providing access to the data, as well as the voluntary community and social enterprise sector, or VCSEs, or third sector, which can influence policymakers and now politicians, now that we have a government again, and demonstrate demand and need for these sensitive data to be used in research. These are often the data sets that VCSE groups have been trying for years to get access to or pushing to be used in evidence-based policymaking. So our approach is a model of co-production that prioritizes engagement in order to achieve impact. This diagram gives you an idea of the cycle that we work on, which the stages are identifying and prioritizing, which are done in partnership and by engaging voluntary community groups, practitioners, and policymakers. We bring them along with us in the form of steering committees and other engagement activities to co-design our research and ensure the methodology is suitable, clarifying the research questions. They support and guide the research while it's being undertaken and managed, with governance provided by the steering committees. They also assist in analyzing and interpreting. This is a really important stage actually to get particularly VCSE groups involved, because it allows them to give some qualitative context to the data that researchers are seeing and can help them understand any gaps in their understanding. Data custodians are also very, very helpful here in understanding why the data looks the way that it does and anything that might be missing. The steering committees and the engagement is particularly important for knowledge exchange and dissemination, which we do in partnership. And also, one of the key things here that brings engagement straight through to impact is that by having the right people on your steering committee who are involved in the research from the very beginning, it creates pathways to impact from the beginning. It means that the people who are on your steering committee are there because they see the usefulness in it and they know that they're going to use it and it's going to be fit for their purpose. So just to go through some of the specific ways in which we do that, we run data workshops. This was a series that we particularly did in the first wave of our project, which was delivered in partnership with the Northern Ireland Council for Voluntary Action, or NICFA, their detailed data project. We identified common themes between NICFA members, which are all VCSE groups, and ADRC researchers, which were carers and caring at that time, mental health and reproductive justice. This is an opportunity for researchers to present their research ideas and what their project aims are, to find out what these VCSE groups who are doing the grassroots work on this issue believe the key issues are to be addressed, and to bring on board collaborators and steering committee members, which we'll talk more about. and refine their research questions. And then it's an opportunity for stakeholders to hear about what data is being held, how it's being used, and what sorts of questions it can answer, as well as how they can get involved in the research. Um, We also, as I said, really focus on project steering committees. These should be developed or established at the beginning of each project, possibly even before the research questions are completely finalized. This acknowledges the value of different types of knowledge beyond the academic. Researchers are meeting with data custodians and providers anyway to arrange permissions, so that's a good time to get them involved. It's also very, very useful to get VCSE groups or service providers involved who have a different take on the issue that you're exploring. A steering group not only develops buy-in from data providers and others, but ensures that researchers are clear from the beginning what impact they think their research can have and should have, and where it's going to be placed. And it allows stakeholders to steer the direction of research from the start and allows a direct line for dissemination. It's really important to get the right people on the steering group, right people with the right expertise, with buy-in. And this offers reassurance around the data practices and analyses and builds trust and transparency as well. And then finally, we work on targeted knowledge exchange events, which are organized in partnership with steering group members and other stakeholders, drawing in relevant public sector, third sector groups to help inform research and policy and provide evidence to shape service provision as well. And then because this is a cycle and not a start and finish process, we've also started moving into developing more involvement focused workshops rather than engagement with data subjects. So the people whose live experiences are actually making up our data sets. In the next phase of investment. So one example, which we had hoped to present at this conference, but which has been delayed due to COVID, was a workshop with care experienced young people as part of our larger program of work on looked after children, which I'll speak about next, where we were going to present our findings thus far, talk about what administrative data is and how it can be used, and get their input on what the next research questions should be. So those we will hopefully be doing more in the future. So our first case study is around long-term mental health outcomes of children known to social services. This is work being led by Dr. A.D. McGuire, my co-author here, and it's linking 30 years of social services data to health and mortality data. So this is very sensitive data sets. So the social services data is being used for research purposes for the very first time. So there's a lot of challenges in terms of making sure that that data is fit for purpose. It's very sensitive data around social services interaction, and then of course, very sensitive data around mental health and suicide. So these are some of the project steering group members, which include the Department of Health and the children's charity Bernardo. So this case study really illustrates the efficacy of the steering committee. We've built a strong relationship with both the Department of Health and Bernardo's. You'll meet a lot of different people from different levels before identifying the decision makers that you really need on your steering group. And as I said, it's important to make sure you have the right people on. It takes face-to-face meetings, kind of pitching your research, showing how it's mutually beneficial. There needs to be conversations around expectations from the get-go. Sometimes policymaking, or often policymaking timelines and academic research timelines don't match up. So it's important to have those conversations before you get too far down the road. Be prepared for people to say no to your offer to sit on the steering committee. We had originally approached the Northern Ireland Children's Commissioner to be a part of this research, but she couldn't commit. So we had to pivot to make sure we still had some kind of representation from that sector. And again, it's important to illustrate how the research is mutually beneficial, and it has to be mutually beneficial. And again, this is where the engagement to impact pipeline really works. You have to show why it's important for them to be involved, even when you know why it's important for you for them to be involved. Then you get buy-in. It takes a lot of work up front, but does pay in dividends. So just to highlight very quickly some positive impacts from the steering committee, which include after presenting a data quality report to the department, the research team required a new data download using advanced matching and data retrieval methods, which was mandated from the department, who have more sway to push data custodians to get things done. After raising the concern that a health and social care number, which is what we use to link the data, was incomplete, this was raised by the department themselves to the governing bodies within the Department of Health to rectify and improve data quality moving forward. After a meeting with the steering group, the research team were informed that new mental health strategy was being developed as part of an imperative for the reestablishment of the Northern Ireland government and would benefit from our statistics. So we had to send the data in very quickly, but this was turned around and written into the mental health strategy for Northern Ireland. We've then been invited to policy events and charity events which build network and impact and really link us in with the people who are using the data within their work, which then helps them as well become advocates for increased data access. Our second case study looks at childcare research and shows how targeted knowledge exchange events and data workshops can work to develop enhanced collaborations. So this research was being led by Dr. Karina Miller around factors affecting maternal employment. This collaboration grew directly out of the original data workshop series that I mentioned around reproductive rights. And during that workshop, a connection was made between the Women's Resource and Development Agency and the researcher Dr. Karina Miller and her work on factors affecting maternal employment, which led to direct engagement with WRDA on research questions, which highlighted the importance of childcare and mothers returning to employment. Further engagement brought in employers for childcare, their partners in the Childcare for All coalition, and facilitated the use of employers for childcare data in the research project, which is an incredible added value that would not have been possible without direct engagement. The next part of that was developing a full-scale childcare policy conference, which Dr. Miller's research formed the keynote and the basis of. This also brought together practitioners within the women's sector, childcare providers, politicians, to discuss childcare policy and how that affects women and their employment prospects. So that was just a brief, quick rundown of how we focus on engagement in order to achieve impact. And just to stress that engagement is particularly important when we're talking about sensitive data sets, as we are within the two bits of research that were highlighted here. It's important to demonstrate to communities, especially marginalized communities, that their data, their life experiences that make up the data sets are being used to benefit them. That's why we talk about public data for public good. And by engaging either those communities directly through involvement or through their representatives, such as VCSE groups, as well as policymakers, we are doing our best to ensure that their data is used to benefit their lives, which also is enhancing transparency and the utility of the data, and hopefully building support for increased administrative data research work. If you have any questions about any of the things that I've spoken about in this presentation, you can of course contact me or my colleague, Dr. A.D. McGuire, on the contact details that you see there. Thanks very much for your attention.